products. So ISFA is a trade group of concerned businessmen and women that manufacture, distribute, or sell vapor-related and other tobacco harm reductive products. We bring together the industry side of vaping to protect members with public affairs efforts at the state and national levels, while also working with city and county council members when issues arise at the local level. Most notably, we worked with the Indiana General Assembly in 2017 session to enact SEA 1, which established common sense regulations on the e-liquid industry while allowing for a thriving marketplace. There is a fair amount of concern that this committee will be sending a mixed message when equating non-combustible vapor products and combustible cigarettes by supporting the current language in HB 1380. We are asking that this committee recognize the chemical constituents, physical property, and health effect differences of combustible cigarettes versus non-combustible vapor products by not including e-cigarettes, e-liquids, and other vapor products under the same age restrictions as combustible tobacco cigarettes. Research has shown that the chemical constituents and the physical properties involved in vapor are significantly different than in smoke. In fact, the FDA recognizes these differences and are regulating vapor products in this separate manner as non-combustible tobacco products. They are determined to reduce nicotine levels in traditional cigarettes, while also recognizing that products such as electronic cigarettes, vapor devices, and e-liquids have potential benefits in the role of reducing death and tobacco-related diseases in America. The FDA Center of Tobacco Control Director Mitch Zeller, a lifelong anti-smoking advocate, has clearly and repeatedly stated that the potential benefits of e-cigarettes. During the Senate Health, Education, and Labor and Pensions hearing in 2014, FDA Zeller stated, "If we could all get those people who currently smoke to completely switch to their cigarettes to non-combustible e-cigarettes, it would be good for public health." Just this month, the National Academies of Sciences, Engineering, and Medicine released their consensus report on e-cigarettes. This report clearly identified the separation of combustible tobacco cigarettes and non-combustible e-cigarettes, reiterating the various public health agencies' stance on combustibles versus non-combustibles. In the NAS report, the authors repeatedly state that e-cigarettes are far less harmful than conventional cigarettes. The study states, "There is conclusive evidence that completely substituting e-cigarettes for combustible tobacco cigarettes reduces users' exposure to numerous toxicant and carcinogens present in combustible tobacco cigarettes." When the national scientists find consensus in the following statement, overall e-cigarette aerosols contains fewer numbers and lower levels of toxicants than smoke from combustible tobacco cigarettes, they clarify the distinct particle separation between the two types of aerosols. Unfortunately, HB 1380 denies recognition of all physical property differences between smoke and vapor aerosols by including e-cigarettes, e-liquid, and vapor products in this bill. To deny the physical science would be both impractical and irrational. Confusing messaging and smokers left in the information gap. We strongly feel that the age restrictions in HB 1380 will ultimately leave a significant number of already users of cigarettes in a discouraging state of information limbo, while also prohibiting underage smokers from using potentially beneficial vapor products when they become legal adults at the age of 18. It seems that if the NAS consensus report recognizes substantial evidence that completely switching from regular use of combustible tobacco cigarettes to e-cigarettes results in the reduced short-term adverse health outcomes in several organ systems, then legislators should also recognize the sound science and that non-combustible vapor products could improve overall health outcomes for adult smokers ages 18 to 20, and these products should not be included in the bill. E-cigarette usage in the youth is as a combustible tobacco problem. Although there will be many proponents of HB 1380 that will claim we have an e-cigarette usage increase here in Indiana regarding our youth, specifically being a gateway to smoking combustibles, research published in the Lancet, which analyzed the CDC data, concluded that 90.6% of young people using vapor products were already smokers. Other studies have similar findings, as summarized by Dr. Holly Madelkoff, a cardiologist from the David Geffen School of Medicine at UCLA, reinforces that e-cigarette use is found in minors who are already addicted to combustible cigarettes. She states, although experimentation with e-cigarettes is increasing in young people, the majority of this experimentation is in established cigarette smokers. That is, approximately 90% of the youth who reported trying e-cigarettes were already tobacco users. Only 0.6% of the non-tobacco smoking high school students reported using an e-cigarette in the last 30 days. So we don't have an e-cigarette problem, we have a combustible cigarette problem. The need for correcting and complete message and product separation. Bottom line, the physical act of vaping is not the same as smoking and should not be treated as such. The public health arena is changing its stance regarding the possibility that non-combustible products have the potential to help existing youth smokers combat addiction by making sure that these products are available for them when they reach the legal age to purchase these alternative products. So what message should Indiana send to the thousands of children who are already smoking cigarettes? Should we tell them that non-combustible vapor products are just as dangerous and that we have no alternative options as they enter into adulthood? I would hope not. But this is exactly the type of antiquated messaging that is riddled throughout HB 1380. In conclusion, the FDA, CDC, and the National Academies of Sciences and other science and regulatory bodies acknowledge the clear differences in chemical constituents, physical properties, and the health effects of combustible cigarettes versus non-combustible vapor products. To acknowledge anything less would be a public disservice to anyone that is 18 to 20 years old. I feel like we are leaving out the gap of adults with this bill. ISFA is just as concerned about chemical exposure to traditional combustible cigarettes. However, there needs to be a clear distinction between vaping and smoking moving forward, and it begins with product separation of combustible cigarettes and non-combustible vapor products by removing all references to e-cigarettes, e-liquids, and vapor products in HB 1380. Thank you for your time.
Any questions? Chairman Brown.
Thank you, Madam Chair. Do you know, in the case of the UCLA study, who paid for that research?
Yes, it was paid for by the United States, so American Lung Association, American Heart Association, the CDC very specifically.
Did you hear the testimony earlier from one of the young, Sydney
I did.
indicated
I did.
The issue of youngsters using the vaping because it's just fashionable?
Yeah, I would agree, but there's some things I would agree with her. You know, we do have a problem with the youth picking it up, but from what we understand from the CDC study, that most of the youth that are picking it up, it's because they've already been smoking. It's an already smoking problem, and the reason why they're going to this is because they're trying to either transition off of cigarettes or find another option.
But there are other options other than the vaping.
Absolutely. Okay. I think those options should, all the options should be available, and that's simply what I'm asking, is that I think we're leaving out a pretty broad category when you say there's a clear difference between non-combustible and combustible cigarettes. So I would want those options left in for those people who are 18 to 20.
Representative Bacon.
Thank you, ma'am. So your study, how you're trying to say that vaping is not harmful in comparison to smoking cigarettes, which I won't disagree with, but your vaping is still harmful.
Sure. I mean, I'm not going to stand up here and argue and say, well, vaping is completely harmless, it's safer than. Specifically, when we're talking about smokers, we need options for those people to understand that there's a clear difference between the two. I'm not going to debate that it's bad for you or good for you. What I'm trying to debate is simply I want options left on the table for 18 to 20-year-olds.
Thank you.
No other questions? Thank you so much, Ms.
Thank you.
Netherton. Lindsay Stroud from the Heartland Institute. Looks like you're here visiting us today from Arlington Heights, Illinois. And then on